I do commute over the hill. It takes me about an hour each way, sometimes hour and a half, depending on traffic going home. So I am sitting most of the day.
Hey, thanks for watching. I'm Dr. Matt Alexander from Alexander Chiropractic, and today we're here with Jenn. And Jenn actually owns a business here in town as well. It's called?
I actually work out of a spa called Industry on Main, and I am an esthetician there.
Awesome. And what are you doing all day long? Were you there?
I am sitting most of the day. So there are some estheticians that like to stand while they do facials. I prefer to sit.
Yeah.
So each of my services last anywhere between 45 minutes to an hour.
Okay.
And I sit on a straddle stool.
Okay.
So
I've seen those, yeah.
Goes up a little bit towards the center.
Like a saddle kind of, right?
I found that to be a little bit more comfortable than just a flat one.
I hear you.
But I'm twisting, I'm getting products, reaching for towels. I do stand up during the service at one point to do like an arm and hand massage. So I try to be mindful about my posture and using my legs more so than my back, but it can be a little bit of a challenge.
So obviously we're here at the chiropractic office today. What kind of things would you like me to take a look at today?
Probably at my posture.
Okay.
And my lower back, since I feel that when I do sit, I just, every once in a while, depending on how I will twist, I'll get a little bit of a, not so much a discomfort, but just, I feel like I could be sitting a little bit better.
Okay.
I do commute over the hill. It takes me about an hour each way, sometimes hour and a half, depending on traffic going home. So that
sitting in the car, sitting at your job, and it's a lot of sitting.
Yes. It's not until the end of my day or shift, so to speak, is when I'm cleaning, bending, walking, moving, lifting. And I'm a full-time mom, so there's that thrown into it also.
So anyways, can you show us where you feel that at?
Usually just right about here.
Right at the base there, huh? Is it more on one side or the other, or is it both?
It's more so on this side.
Left side? Okay.
Yep.
Interesting.
And I don't know if I just favor that side more, maybe, that hip. I am right-handed, so right dominant, but I do sometimes lift this leg up during treatment and put it on my stool, so I might be just shifting a little bit more.
Just want to make sure nothing's out of alignment in there.
Huh? Yeah.
So have you had any major injuries to your back or neck or any area that I should know about that would affect our treatment today?
No. I have recently completed physical therapy for my knee. And I was in there for about 4 months. And it was just honestly, it wasn't so much like an injury, like a fall or anything last fall. It was just my knee not, I don't know how they worded it.
Was it patellofemoral syndrome?
It was the inside.
Where it's not tracking right?
Yes. I have that.
So runner's knee.
And then also from here, and I did used to run several years ago, and at that time it was this knee, and they said no more running. So then I got back into the gym about a year ago. I'm on this wellness journey right now. So I have been losing weight, but that kind of re-aggravated. But right now I'm fine. Okay, good. So...
Well, it's just something to note because, you know, if there was something wrong with a leg and it caused you to walk or maybe not want to put as much pressure on it, that could definitely affect your back as well. So it might not be anything, but it's good for me to know. Yeah. So, all right, so we'll go ahead and start in with the exam. I'm going to check your posture. So I'll have you stand up. Okay, so I do notice that your right shoulder is higher than your left shoulder.
Okay.
And I'm going to have you twist side to side like that for me. And tell me if you feel any discomfort in your lower back at all. Is that okay? Or do you feel it?
Okay.
Yeah. What about side to side like that? Do you feel anything with that? It's okay?
Yeah. No, it's okay.
What about bending back like that?
I feel a little bit there. Just a little bit of, maybe it's because it's awkward for me. But not so much.
Not pain, just
pain, just like, oh, that's different.
Like a pinch?
Kind of a pinch, yes.
Okay. Let me have you go down straight forward there. Okay, stay there. Good. All right, come on up. And then I'm going to have you lie down, face down here on this table here, okay? So I'm going to push on here. Do you feel any discomfort pressing on these joints here?
No.
Okay. What about down in here?
A little bit.
A little bit there?
Right there.
Okay. Is it more on that left side?
Yep.
Okay. What about here?
No.
No. Okay. So this looks like L5 on the left. Definitely tight. Okay. And some tightness of your upper back here too. Do you ever get any symptoms up here at all?
I do.
Okay.
And I think a lot of it is that's where I hold my stress.
Yeah.
And just from using my upper body when I do like the massage part of my facials.
This is called flexion distraction. Have you ever had this before?
No.
Do you feel okay doing this?
Mm-hmm.
Okay, good. So this is going to help us to stretch out that spot in the lower back, okay?
Okay.
Maybe a push here. There we go. Good. One on this side. Excellent. Okay. I'll give you a little push here, okay? Excellent. All right, let's do one on the other side. Good. Just relax. I got you. Excellent. Push here, so we're going to come right in here and just relax there. Good. Nice.
Wow.
All right, one more. Good. Smaller one on that side. It's okay, good. You doing all right?
Mm-hmm.
Okay, we got one more adjustment to do on you, okay?
Okay.
This one we got to do standing though. So for this one, you're going to kind of put your hands behind your head just like that. And I'm going to come up behind you like this. Good. We're going to go here. I'm going to have you tuck your chin there. Good. And I'm going to have you take a deep breath in and breathe out and bend your knees a little bit and look up. Good. Just getting a little movement there. I want to do a little more adjustment on that because I think we can get it deeper. Let me have you go ahead and lay face up. Okay, take a deep breath in for me and out. Nice. Good. One more in. There we go. That's what I wanted. Just go ahead and move around for me a little bit. How's the lower back feeling right now?
Feels really good.
Better?
Yeah, a lot better.
Mid back. What about the neck? Go ahead and give that a little move around. How are we doing there?
Good.
Okay. If anything's tight at all, you can let me know and we can
I
get in there and feel it.
I feel a major difference.
Okay. Nice.
Especially my lower back.
Oh, good.
Yeah.
Okay. Well, just to recap, you came in again, you had the lower back, and then you also told me you had some neck stuff as well because you're sitting in the car for a long time and then sitting at work and sure you're using your arms a lot as well too.
Yes.
So. What was your experience today? Was it what you were expecting or was it different than you were expecting?
No, it was awesome.
Okay.
Actually, it was way better
Okay.
than I was expecting. The whole environment here is really comfortable, by the way. It was very welcoming just from like walking in. But as someone who used to go to a chiropractor many years ago, I've had a child since then, lots of stuff going on. Not so much I was afraid, but I was afraid, I was afraid that it was going to be really uncomfortable.
Yeah.
And I feel so much better. It wasn't uncomfortable at all.
Awesome.
It wasn't
Cool.
scary. Yeah.
Nice.
So.
Well, a lot of people have that fear,
Yeah.
right? And they see the moves that we do and they're like, ooh, I don't, especially if they hurt already, they're like, oh, I don't want someone to touch that area because it might hurt worse, right?
Yes.
But what I found is a good chiropractor has different speeds, if you will, or different force levels. And I typically will usually start light on somebody because you can always give more force later, but you can't take it back once you've given too much. And there's also a finesse to it. Everybody's going to be a little bit different. It's we call it the art of chiropractic.
Okay.
And so, there's the brain part, there's the science part of knowing how to diagnose a patient and figuring out what's wrong, but then there's the hands-on art part of it, of actually delivering the therapy. And that's where you're going to get a lot of variation between different chiropractors. I kind of say, chiropractic is kind of like a box of chocolates. You never know what you're gonna get, you know.
Yeah.
And sometimes it's a happy surprise.
Hopefully.
Yeah. Unfortunately, it's,
Yeah.
you know, just like any profession, some are better than others. But I'm really excited that you had a good treatment today and that we were able to get you taken care of. There are a lot of great chiropractors out there, and I would definitely recommend people, if they're scared, to just give it a try, you know. And if you're really apprehensive about it, just ask your chiropractor to go a little bit lighter the first time. That way you can see how your body responds to it. So if there are any other people out there that are curious about chiropractic, what would be your last words to just tell them?
I would say do it. We're only given one life, and all of us are always so busy, go, 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 that it's something that I actually talk about in my own practice for aesthetics, is you need to take that time to take care of yourself. And you don't want one little thing to get blown up into something really bad one day as far as like your physical health. So if you can, preventative is best.
If you don't have your health, what do you got, right?
Yeah.
Plus you got a little one at home.
I do.
So if you got to care for other people, it's like when you're on the plane, right? In the oxygen mask, you got to put your own on first. You got to, if you're not healthy, how are you going to give 100% to your daughter and your family that you need to take care of, right? So.
Exactly.
All righty. Well, thanks for coming in.
Thank you, doctor.
Appreciate you.
Thank you.